powerful earthquake has struck western Colombia, and the scale of devastation is becoming clearer by the hour. A massive 7.4 magnitude earthquake has rocked the country, leaving communities buried under rubble, buildings damaged, roads disrupted, and emergency teams racing against time to find survivors. At least 132 people have reportedly been killed, and more than 570 others are injured. But with rescue operations still underway, authorities fear the numbers could rise further. The earthquake struck at around 7:34 in the morning on August 10th, with the epicenter located near San José del Palmar, in the department of Choco. The United States Geological Survey has placed the earthquake at a depth of around 107 kilometers. And despite the quake being relatively deep, its impact has been devastating across western and central parts of Colombia. President Abelardo de la Espriella has declared a state of emergency as authorities struggle to assess the full scale of the destruction. One of the biggest challenges is unfolding in Choco. Choco is Colombia's poorest department, and many of its communities are remote, isolated, and difficult to reach even under normal circumstances. Now, with roads damaged and communications disrupted, getting emergency crews, medical supplies, and heavy rescue equipment into affected areas has become an enormous challenge. For people trapped under collapsed structures, every minute matters. And that is why police, firefighters, soldiers, and civilian volunteers have been mobilized across the affected regions. Rescue teams are searching damaged buildings, clearing rubble, and trying to locate anyone who may still be alive beneath the ruins. But Choco is not the only region facing a major crisis. The coffee axis, one of Colombia's most important agricultural regions, has also suffered significant damage. Pereira has emerged as one of the worst-hit cities, with heavy casualties and destruction reported. Across the affected areas, hundreds of homes have been damaged. Authorities say around 1,177 residential buildings have suffered damage, with 37 reportedly destroyed completely. More than 60 buildings have also collapsed. And the earthquake has damaged critical public infrastructure. At least 18 health centers have reportedly been affected, along with 52 schools. That means the disaster is not only creating an immediate rescue crisis, it could also disrupt healthcare and education for thousands of people in the days and weeks ahead. And perhaps most alarming, some hospitals have themselves been damaged. In Cali, a hospital suffered structural damage during the earthquake. Parts of the building collapsed, leaving patients trapped and forcing emergency teams to carry out evacuations. Rescuers managed to pull 4 people alive from the rubble. That included 2 women and 2 children who were rescued from a collapsed structure. But emergency workers are still searching, because every damaged building could potentially contain someone who is still waiting to be found. The danger doesn't end once the ground stops shaking. After a major earthquake, aftershocks can further weaken already damaged structures. Walls can collapse, floors can give way, and rescue operations themselves can become extremely dangerous. That is why authorities are assessing buildings before allowing people to return. 5 capital cities have reportedly been placed under red alert. As officials monitor the situation and prepare for additional emergencies, the earthquake was felt far beyond the immediate epicenter, with tremors reportedly reaching areas as far away as Bogotá. And the Colombian geological authorities have described the event as one of the strongest earthquakes recorded in the country during the 21st century. That gives an idea of the scale of what emergency services are dealing with. But there is another major problem: access. In some of the worst-hit areas, damaged roads are slowing down rescue and relief efforts. Communications have also been disrupted, and in remote communities across Choco, that isolation could prove especially dangerous. Emergency authorities therefore face a race against time, not just to rescue survivors, but to deliver food, water, medicine, and other essential supplies. And Colombia is not facing this crisis alone. International assistance is already being offered. Ecuador has offered a specialist rescue team of 47 people, along with search dogs and equipment capable of supporting operations for several days. Mexico and El Salvador have also offered assistance. And the United States has announced a relief package worth around $15.5 million. While the U.S. State Department says it is ready to support Colombia during the crisis, the United Nations has also indicated that it is prepared to assist if required. But international rescue teams can only do so much, because the immediate priority remains the same: find survivors, reach isolated communities, treat the injured, and prevent further loss of life. The earthquake has also exposed the vulnerability of critical infrastructure. When hospitals are damaged, the very facilities needed to treat earthquake victims become part of the emergency. When schools collapse, children lose not only their classrooms, but potentially safe spaces for their communities. And when roads and communication networks are disrupted, entire communities can become isolated from the outside world. For Colombia, the disaster is therefore much bigger than the number of buildings that have collapsed. It is a national emergency involving rescue operations, healthcare, transport, communications, and the long-term recovery of communities already facing serious economic challenges. And in Choco, that challenge could be even greater. The department already suffers from high poverty levels and limited infrastructure, so rebuilding homes, roads, hospitals, and schools will require enormous resources. For now, however, the focus remains firmly on the rescue operation. Emergency workers are continuing to search through rubble. Authorities are assessing structural damage, and families are desperately waiting for news about their loved ones. The coming hours could be critical, because beneath the rubble, there could still be survivors, and every successful rescue offers a moment of hope amid an unfolding catastrophe. But once the rescue phase ends, Colombia will face another enormous challenge: rebuilding homes, restoring roads, repairing hospitals and schools, and reconnecting communities that have been cut off. The 7.4 magnitude earthquake has already left a trail of destruction across western Colombia. And with the death toll and damage assessment still evolving, the full scale of this disaster may not yet be known. For now, Colombia is racing against time, searching for survivors, helping the injured, and preparing for what could be a long and difficult road to recovery.